Hi, I'm Jeremy Rueggeberg. Thanks for joining the show. What you're about to see is the shortened version of the full-length interview. If you'd like to see more of the interview, please go to our Patreon page. Information is in the show notes. Now, let's get to the show. Well, once again, I'm headed down to the studio to meet a great medical provider, Davis Mellick. Davis is married to another great provider, Rachel Mellick. And being a great provider couple, they've even provided the world, with two amazing children. Davis also provides the world with a pretty stellar beard, and he provides me with loads of laughter. He's insightful and knowledgeable. He's got Jedi Master-like trivia and random factoids packed into that beard. And oh yeah, did I mention the beard? I think I mentioned the beard. Well, join us for the show, and if you like it, please subscribe and tell your friends about it. Stay tuned. Davis, welcome to the show. I'm glad you can make it.
Thanks for having me.
What do you think about, the blue jacket? You wore a blue shirt?
Well, when I grow up, I want to be just like you.
Okay, well, you have the shirt and the glasses.
I do. So do I start calling you Daddy now?
And we'll start with the show again. Hi, Davis. Welcome to the show. I'm glad you're on the show today. We have to remain professional.
Absolutely.
Okay, so in any case, anytime when we're not professional, we need that overdub of your voice going, professional. Okay, perfect. Davis, again, welcome to the show. So glad that you're here. We've known each other now for probably coming up on 2 years. We have actually an awesome picture of you and your beautiful wife, Rachel. You're on the front cover. You donned the front cover back a few years ago. And so that's kind of where we got to know each other. I wanted you on the show because you have a very interesting story and you have an even more interesting beard, which we'll get into in some moment. So just for people who don't know you, I know it's like one or two people probably in Antarctica, but for everyone else who doesn't know you, tell us a little bit of something about yourself, where you're from, how did you get in medicine? Tell us a little bit about what I like to say, your genesis story.
Yeah, so I grew up here in Augusta. I moved here in 96, was an Army brat, and didn't actually think I wanted to do medicine. My dad was a ER doc, and I wanted to, I don't want to be like that. And as I kind of got into it, I actually started off as an English major, really loved writing, was really good at it, and I found it boring in the end. And I found the one thing that really challenged me was science, and so changed my major to chemistry, and it just kind of blossomed from there and realized, man, medicine, it's ever changing, it's ever challenging. You'll never be a full master of it. Data's always changing. You just have to kind of play catch up all the time and reanalyze it. And so I went to PA school here locally, went to MCG. It started off doing emergency medicine and, really enjoyed it, enjoyed the fast pace. As time has gone on, medicine has changed a lot. It's become a lot more about metrics rather than actual patient care. And that really bothered me. So I pulled out from doing ER full-time. I still actually do it part-time, but ended up opening up my own practice, doing direct primary care, which really allows for real patient care. Gives you the time with the patient, gives you the ability to read and, learn more as well. And it's a sustainable way to practice medicine. And I gotta say, I love it.
I love it too. You could say I'm down with DPC. Professional. You mentioned your dad, so I wanted to ask you a little bit more on that. What are some of the roles that your parents, family, or friends have played in your life? It doesn't necessarily have to be medical based, but formative things that have happened, maybe from your parents that you remember that have influenced you to be where you are today or who you are today.
Yeah. So my dad was always a really hard worker. And he loved doing research. He loved writing papers and big in academics, loves teaching. And that really inspired me. It's one of those things that you can really just constantly pour yourself into. You make a real big difference down the line as well, not only with your patients, but with, future medical professionals as well, along with, the ancillary staff and everything along those lines. I still to this day will have people come up and be like, hey, are you related to, Dr. Mellick, Larry Mellick, over at, MCG? I used to, be a janitor there, and he, helped me out, or I saw him do this, or I worked as a nurse, 15 years ago with him, and I still remember him, and we love his YouTube videos. He's really, technologically inclined. I am not. I'm the ne'er-do-well son. That being said, he really revolutionized a lot of the ways that academics is performed. And he's always just been really, really humble about it in the process. And so you see a lot of pride in healthcare, and there's not a place for that because it's a humbling profession. There's always that chance you can be wrong. And so he really was one of the big influences. Along the ways I've had, tons of other, PAs, doctors, nurses, nurse practitioners, respiratory therapists who take the time to kind of invest in you and teach you. And it really is a team sport. And so, I could sit here and list off a third of all the Augusta medical professionals that are out there. And that would only hit some of the ones I remember that have actually.
And I think that's one thing why I think you like the DPC model, direct primary care model, so much is because it goes back to patient-centered care, and it gives the provider the opportunity to actually spend the time with the patient to do what's best for them. I'm a huge fan of direct primary care. I think it's a wonderful idea. It's really cool that you and Rachel are, if I can get this right still, you guys are the only PA run and staffed DPC in the state of Georgia?
Correct. So Georgia law, you can't actually employ your supervising doc. So Georgia's kind of a little archaic when it comes to PA law here.
Get your stuff together, Georgia.
Absolutely.
Be professional.
And so Dr. Boland, a doc I've worked with for 6-7 years off and on, fantastic guy. He has ownership as well within the practice, but we have majority ownership. We were able to run it. He is our medical director, but he sees occasionally some patients there, but it's primarily us. And so,
who is your ideal client? If you could, a lot of people are hearing DPC for the first time, especially in Augusta, Georgia. But as far as the general public, who's your person?
Everyone needs primary care. It doesn't matter your age, it doesn't matter your race, it doesn't matter your gender. Everyone needs primary care. And primary care really can do a tremendous amount if you've got time. And I think a lot of times they'll have, we'll see 20, 30-year-olds who are like, well, why do I need it? I'm healthy otherwise. Well, one, we do a lot of preventive care. And so primary care is the only specialty that actually adds years to your life. If you look at big number statistics. And so we're really trying to prevent things from happening 20, 30, 40 years down the line, which is sometimes hard to conceptualize. But sometimes they'll see a primary care elsewhere. They're like, I spent 8 minutes talking with someone. It took me 3 hours to have that done. And I really
had to take off work.
Yeah. Really felt like nothing happened. And then they'll come to us and they'll be like, wow, that was actually really informative. We can talk about diet. We can talk about, exercise. We can talk about other lifestyle changes that play the bigger role in their long-term health. help coach them along those lines while also, making sure they're getting their colonoscopy, their mammograms, making sure their PAPs are getting done. We can also do, primary care is really trained to do a lot, but they stop doing a lot because of the time constraints and decreased reimbursement. Well, I don't really have to worry about that. So if I do a skin biopsy on someone, we can send it to pathology. It costs $84 for the pathology fee. And we just charge our out-of-pocket cost for our materials. And so, we're talking 15 or 20 bucks, something along those lines.
Mm-hmm.
And so one of the greatest barriers to healthcare isn't accessibility, like what everyone thought and what the purpose, I think, of the Affordable Care Act, not to go deep into the politics here, but the biggest barrier is cost. And so if you can make it accessible, affordable, convenient, without taking away from the provider's income, there's no reason not to do it this way.
Right. You down with DPC? Yeah, you know me. You down with DPC? Yeah, you know me. Who's down with DPC? Every last provider.
And me. There's so much spit in my hand.
Let's go back to quickly. How would you describe yourself to somebody who doesn't know you? You had asked me that and kind of prepped me for this. And so I don't really have a great way to explain it. I guess I'm just passionate about medicine, passionate about my family, and I'm a little weird. I'll own it. Don't have a good filter. And so, as one of my students said, I was the least professional rotation they had ever had. And she kind of backtracked. She's like, I meant it as a compliment, though. This is fantastic. Out of all the professionals, you're the least professional.
Yeah.
Do you have any specific words that would describe you well?
Definitely sexy. That's actually, Justin Timberlake actually wrote that about me. Probably a little random, I think, would be another.
Random is a great word to describe you, Davis.
I've been accused of being distractible at times, but I'm pretty good at circling back as well. So,
do you have a rapper name, by the way? If you could be a rapper, which I'm sorry.
Yeah.
I know you beatbox. You freestyle beatbox sometimes.
Yeah. Cocoa Butter would be my rap name.
Cocoa Butter.
It's probably a little more R&B, kind of smoother with a little bit of rapping. Yeah.
I like it. A little viscous to the touch, to the ear.
Smooth like honey. Or cocoa butter.
And hot like butter.
Yeah.
If you could have a nickname besides Switchblade, what nickname would you have?
Diamond.
Diamond? Now tell us about Diamond.
Well, that would be my dancer name.
So strip name. Okay. A diamond in the rough. So tell us about one event that maybe has shaped you in your career. Can you I guess put flesh on the bones for us? Like, I'm in the ICU. Blank happened. Justin Timberland walked in with his Timberlake boots or whatever it was.
I think probably one of the things, we get taught in school really poorly on how to deal with death. And so, it's kind of cookie cutter at times, and you try to ease people into it and everything. And death isn't like that. Death is abrupt, it's brutal, and you can't ease someone into it. All it does is just kind of create a dramatic effect, and patients and families don't need drama. They need the kind of realistic aspect behind it, but they also need compassion. They don't necessarily need an answer. They need to say hey, this is what's happening, or this is what has happened. I'm really, really sorry. And you don't try to give them reason why or anything like that. And I actually learned some of that kind of compassionate approach from Christopher Schiffbauer, a nurse practitioner friend of mine. And so just seeing the way he interacted, initially here you are in an ER, it's busy. And I'm why is he taking all that time to console this family or talk with this family? And because you kind of get in this mindset of just, okay, death happened, now move on. And that's realistically probably damaging, not only to yourself, but also to the patients and their families. And so he did a wonderful job of taking the time, talking with the family, consoling them, hugging them, crying with them. And, I realized that's actually really healthy. We should be able to mourn as well with our patients. And I've learned from that. I probably witnessed that like 7-8 years ago. And I've definitely carried that with me, and it's really helped. We see death on a regular basis. We see people who are going to die no matter what we do, no matter how aggressive we've been, and being able to have a very real and frank talk about it, and just be able to just lend them an ear, just let them cry on your shoulder, cry with them if it's appropriate, because sometimes, hey, it's okay, you got to have feelings too. Has really made a difference overall, and I think it's also helped patients and family members understand the inevitable nature in some cases, and so it's just because otherwise sometimes you just want to fight, right? I mean, it's and so when you can be empathetic and compassionate with them and take that additional time, it really makes a big difference. And so that would be one of the big ones.
Yeah, I appreciate that. I don't think I think about that enough. That a lot of times. I think the general public, our view is the provider, the nurse, the PA, the doctor, whoever it is there to take care of the patient and the family. In the mourning process, even in the mourning and grieving process of bad news, right? Mm-hmm. But that provider is a human being too. And so if they can mourn and grieve, it also helps them heal and move through those emotions in a healthy way rather than just stuff it down or drink it away, or whatever you do,
Oh, yeah. The unhealthy coping mechanisms in healthcare are giant and extremely prevalent.
What are some of the largest ones that you've observed in your time?
Alcohol, absolutely. I think there was a statistic that in the ER, 10% of the staff were currently under the influence of drugs or alcohol while working. And
wow.
So something along those lines. And I don't know if that's really true. I mean, I've only seen a few cases of it like that.
So speaking of alcohol and coping, let's take a swig of our alcohol. Thank you, Savannah River Brewing. This is Dungeons and Flagons. And in light of us being HIPAA compliant, we call this IPA an IPA. We'll be IPA compliant.
IPA what?
IPA, woo, woo. That is really good. Holy cow. Can we just drink for the rest of this show?
Yeah, absolutely. I had a hard weekend, man.
It was difficult?
Coping. Professional.
You got to look at the and be like, professional. Well, let me ask you this. I'm changing gears just a little bit, but take me back to, there's a time in a day, I've heard this story, and it goes back to your nickname, your street name, Switchblade. Tell me about the story behind Switchblade.
So, we were on a mission trip to Mexico. Mexico. And we were at this big open air market, and I was 8, 9, something along those lines, and we were buying illegal fireworks, and I
Spanish fly, all the things you get in Mexico, right?
All the things that and we probably, if we were smart enough, we would have bought like alcohol and stuff, because they'll sell anything to any gringo at that point in the market. And so I ended up stealing a Switchblade. And then we went through the checkpoint, and I was like sweating profusely because you had to kind of drive back through the border. And, I was like, are they going to search me? Are they going to find this? Am I going to go to jail? Am I going to be in a Mexican jail? And they didn't really care because we all had our passports, and they were just like, all right, go through.
So what's the favorite part of your body?
Probably my third nipple.
You really have a third nipple?
Yeah.
Unbelievable. Yeah. You never thought about getting it removed or lasered or like a matching tattoo on the other side? So do you have a bucket list for 2021 or something you would like to see yourself accomplishing?
Yeah, I'd like to open up another DPC office. We really want to expand out into a little bit more of the rural areas of the CSRA. So, get out like Harlem Thompson area, maybe even get an office down in South Augusta as well. We really feel like it's accessible for pretty much everybody. That's one of the big ones. That's pretty much it.
That's it. So that's a career goal. Is there anything else? Like, would you like to be able to bench press 95 pounds again? Like,
I'd like to break 100. I really would.
Let's not. I mean, this is 2021. There's not much left. So
I would like to break 100 on the bench press, and and maybe if I can get 5 like real push-ups, not the ones from my knees, then that would also be really good.
What gets you into a bad mood? I don't think I've seen you in a bad mood, but what gets you in a bad mood?
Bad mood, probably simply like administrative bullshit. So yeah, that's part of the reason why like I left, from the rat race of medicine to actual medicine.
Yeah, you don't want to be an administrator.
Yeah,
be a provider,
and making sure you're hitting all your different checkpoints and things like that. Are some of those things important? Absolutely, but when you're kind of like making sure to kind of have all these timetables checked and all that, and they're putting all that weight on you, and it's like, well, there's like 30 other people involved. How is that completely my responsibility? Don't ask questions like that. That probably is the one thing that pisses me off.
So once you're in a bad mood, is there anything in particular that just gets you back into a good mood?
I don't last long in a bad mood, so I try to choose to be happy, and so
let's walk people through that process, because happiness is a choice, and joy is a choice, and so how do you're having a bad day, things aren't going well at work, you're in the medical space, a lot of pressure, a lot of unknown, a lot of frustrations, things you can't control, you're in a pissy mood. How do you choose joy?
Sometimes with music, you make the mental choice of like, I'm not going to let this bother me anymore. I'm going to move on. And
is there a song that inspires that? Is there like a Beyonce song, a Justin Timberland?
Really, I kind of always go back to, I like big butts and I cannot lie. You can't be angry or sad when you listen to that song. And mostly because I do like big butts, and I cannot lie.
Yeah, that's the great thing about him. He was so honest from the beginning. And I admire Sir Mix-a-Lot for his honesty.
Yeah. And so I didn't realize he was a knight. And so I really think that's interesting that the Queen actually knighted him.
And so that gets you into a good mood.
Yeah, absolutely.
Okay, fair enough. I like that. Hey, Jeremy.
Hey, Davis.
So, what do you think about, the podcast show?
I think it's just going to fail miserably, honestly. I don't see how we're going to be able to sustain this. We've got no followers. We don't have attractive people on this show. This has to be sexy. And can you try being sexy?
I'll give it a shot. So we're going to wrap this up real quick, but is there anything, I know we talked a lot about problems and things like that. We also talked about rap, escapades in Mexico. So there's some really positive things. But is there anything that you're really grateful for that we can kind of leave on a high note?
Yeah, I'm really grateful for the support of my wife. So that's not my wife, just in case anyone's wondering. Maybe that picture will get thrown up there. I definitely married like way above my league. Don't tell her though. I don't want her to get any thoughts.
She will never watch this podcast. By the way.
Oh no, absolutely. And if she does, she'll give me the frowny face. Just the disapproving. You said what? And so, but definitely really thankful for my wife. She's been incredibly supportive through all of this. And so, questions me when things need to be questioned. She doesn't like just blindly, follow my lead. She goes, raises the real, well, how are you going to afford that, Davis? Good point. I didn't think about that,
we have 2 kidneys, right? You could sell one.
Yeah, you can make money off testicles.
You've got 2. I got 3 nipples. I can harvest the 4th, sell them off.
You got 3 testicles, you can afford to get rid of 2. And so that, I'm also just really like, the medical community has definitely changed as time has gone on in a lot of ways, it's kind of become a lot more like distant. And I'm really grateful the fact that I've got a lot of colleagues that I can just like, hey man, I need a nephrologist, hey man, what do you think about XYZ? And, I'm going to send them your way. Before I do, what sort of things do you want? Being able to have a, medical like colleagues like that you can just reach out to, communicate with, or, don't say like, man, you idiot, why'd you do that? Or why didn't you do that? Is really, really beneficial. And I think is really important with kind of getting back to the basics of medicine as well.
I love that. I think, I'm assuming, but I think you probably would not have had that unless you did those 10 years in the system, right? Absolutely. That's where you made those relationships.
Yeah, absolutely.
Right? And now you can pull from them. Most important question we're going to end with is, what do you like most about me? And we'll give a good 10 minutes to this.
Yeah, so things I like most about you, your kind of graying beard, your salt and pepper hair, the way you kind of comb your hair forward to kind of hide the receding hairline, I think is really like...
It's to enhance it, actually.
It looks really good. Like no one knows it. It's there. The blue jacket as well, but also the way that you've kind of seen the need to create a medical community, and you've kind of come out as like, here's someone with no medical background setting forth to really, saw a need, and you've gone forward to kind of create this medical community and bring to light medical professionals who a lot of times, just kind of, sit behind their closed doors and sit in front of their computers and, sit in front of their patients and that sort of thing. Even though they're making big differences, they don't really get a lot of recognition. And so I think that's actually really cool.
Well, thank you so much. Thanks for being on the show. Just on a more of a serious note, I hear your name come up quite a bit, and everyone from nurses to doctors, they appreciate you. They respect your opinion. They might not like the way you look, but they absolutely trust you. And that's a huge compliment for where you are and what you've earned and made for yourself being this young and in the medical space. So thank you for serving Augusta. Thanks for being on the show. And if people want to follow you or learn more about DPC, I guess we can put that in the show notes, but what's the best way for people to contact you? And
our website is a great way. Also our Facebook page. Our website is www.evansdpc.com. Excellent.
I'm sure people will have some questions, and you're taking patients actively.
Yeah, we're taking new patients. And so, I'm going to end up capping my total number of patients so we can still provide the same, personal level of care, but we're going to keep on growing DPC. So as more patients come on, we're going to bring on more providers so that we can keep doing the same quality care that we've been doing.
Nice. I love it. Appreciate it. Thank you for being on the show. Take care.
Thank you, sir.
Bye. Thanks again for joining us on our show. I want to thank our special guest, Davis Mellick, for being so wonderful and transparent and bearded. If you want to follow us for more information about the show or just subscribe, go to our YouTube channel here. Go to our Instagram channel here.